Good morning, everyone. Welcome to this hearing today, and I am delighted to especially welcome our leadoff witness, Gyanti Cook, and his mom and dad. Gyanti, in a few minutes, each of us are going to make some statements, and then we'll turn it over to you to say whatever you'd like to say to us. Over the past few years, the subcommittee has been focused almost exclusively on how our federal government can achieve better results for less money. Among other things, we've examined cost overruns in major weapon systems, overpayments for additional spare parts that we don't need. We focused on how to better manage our federal property, on bloated information technology projects that waste millions, some cases billions of dollars, and most notably for today's hearing on how we can spend taxpayers' dollars on prescription medications in our nation's public health care system. In fact, today marks the third in a series of hearings over the past several years examining this particular subject. Nearly 2 years ago, our subcommittee asked the Government Accountability Office, called GAO, to look into the potentially improper prescribing of mind-altering medications, also known as psychotropic drugs, for children in foster care whose health care is paid for through Medicaid and managed by the states. We learned through various media reports and medical articles that many former children, foster children, may have been receiving these medications at alarming and potentially dangerous rates. If these reports were true, not only were taxpayer dollars being wasted on these medications, but more importantly, the health and well-being of these children was very likely in danger. We wanted an independent government audit from the GAO. In asking them to look at this issue, we wanted to know if overprescribing or improper prescribing of these powerful, mind-altering medications was occurring, and if it was, how prevalent was that, and what were the costs? The report we are releasing today confirms some of our worst fears. GAO's findings reveal that foster children in the 5 states that were examined are receiving mind-altering medications at between 2 and as high as 4.5 times the rate of other children under Medicaid. In 2008, the 5 states combined spent over $59 million on mind-altering medications for foster children. Beyond these rates, the GAO found 3 alarming patterns in their data. First, thousands of children were prescribed mind-altering medications in excess of the maximum doses for the child's age as recommended by the FDA and by medical literature. Furthermore, for the medications for which there is no FDA-recommended dosage for their age, the GAO found a number of children receiving dosages beyond those even recommended for adults. Second, more than 600 foster children in these 5 states were found to be receiving 5 or more mind-altering medications at the same time. According to medical experts, one of whom is with us today as a witness, there is no evidence supporting the use of 5 or more mind-altering medications in adults, much less for children. In fact, I'm told that there's only limited evidence that supports the use of even 2 mind-altering medications being prescribed to a child at the same time. Finally, and perhaps most disturbingly, dozens of foster care children under the age of 1 year in these 5 states and over 3,500 non-foster children in those states were prescribed a mind-altering medication. According to medical experts, there are no established medical health uses for mind-altering medications in infants, and providing them these drugs can result in serious health effects for them over both the near term and the long term. We look forward to hearing more about the GAO's findings today. Greg Coots from GAO has joined us to discuss them. He's appeared before this committee, the subcommittee, many times before, and we welcome him back today. Along with him is Dr. Jack McClellan from Seattle Children's Hospital. He's one of the medical experts hired by GAO to review their report. Mr. Brian Samuels is here from the Department of Health and Human Services to give us the federal government's perspectives. And while Matt Salem is here on behalf of the state Medicaid directors, we welcome all of you. I'm probably most interested, however, to hear from our first witness today, Mr. Keontae Cook, who joins us all the way from McKinney, Texas. Keontae, I like to say you're the one who came the furthest for this hearing. Mr. Cook is here with his mom and dad. I was fortunate to spend some time with all of them here earlier this morning. And we look forward to hearing a little more about him and his experience in just a few minutes. I also hope that today's hearing and what comes from it will end up helping kids like him from all across the country. So something very good may happen because of your appearance here today. In anticipation of today's hearing, the Department of Health and Human Services sent a letter last week to all 50 states regarding the proper use and monitoring of mind-altering medications for children in the foster care system. The letter promises that the Department will convene a meeting of all 50 states in the next few months to discuss this issue further. It's my hope that the Department's letter also serves as a signal to states that more detailed guidance is coming, guidance that reflects the best practices from states across the country with regard to the use of mind-altering medications to treat children. It's also my hope that this letter will lead to solutions that will help to improve the health and wellness of some of our nation's most vulnerable children, foster kids, while also saving taxpayers' dollars at the same time. I believe there's plenty of blame to go around in this report. Unfortunately, it appears that the federal government, state and local governments, doctors, nurses, and perhaps others haven't kept up with the increased frequency with which mind-altering medications have been prescribed over the past decade for children. There also appears to be a lack of cooperation between the Health and Human Services Department and the state Medicaid programs throughout the country concerning this issue. States have worked out piecemeal solutions based on their own experiences, and frankly, in at least some cases, those solutions were not arrived at until after young lives were damaged or in some cases lost. As I mentioned, and as we'll hear in testimony today, the children discussed in GAO's report are some of the most vulnerable members of our society. It's our responsibility to take up their cause. As a former governor, I know that the foster care system is complex, but I also know that complexity is no excuse for not dealing with this issue head on. We all have a responsibility to ensure that the Medicaid program works for all children that it serves, whether they're in foster care or not. I oftentimes describe the 50 states as laboratories of democracy. And what this report reveals is that some states are managing their program better than others. That should not come as a surprise. There are best practices in use in some states that really do work in helping foster children. Every state should be adopting those practices or tailoring them for adoption. In addition, the American Academy of Child and Adolescent Psychiatry has promulgated some very good guidelines, which both the GAO and others cite. And if they're not already doing so, more states should follow those guidelines. What we can't do is wait for another tragedy to happen before we make the right decisions. We can't stand idly by while children's lives or health are potentially put into danger. Now, to be clear, it's important to realize that these drugs we'll be talking about this morning are often used in dire or even tragic situations. In most cases, they're prescribed as intended and used in an appropriate manner to help children who have experienced significant trauma in their young lives. In these cases, there's no doubt about their value. What is in doubt are the patterns and practices identified in GAO's testimony today. What is in doubt is the effectiveness and necessity of having children take 5 or more mind-altering medications at the same time. What is in doubt is an infant being given antipsychotic medication. In these cases, I don't see any gray areas. What I do see is more black and white. What is appropriate and humane and what is not. We need to begin the process now of developing a consensus about what is appropriate and humane when it comes to prescribing mind-altering medications to children and end the bad practices that are putting children in danger. We need to act quickly before one more child's life or health is placed in jeopardy or before one more taxpayer dollar is spent inappropriately.